I'm getting hip surgery at the age of 22. Let's talk about it. So this video is going to be a little bit different than my usual vlog lifestyle type of videos that I do, but instead I wanted to film what led up to me getting hip surgery. So actually my motivation for filming this video is because a few months ago I posted 2 TikToks about my labrum tear and I got a lot of responses from people dealing with similar things. So I'm going to be pretty real with you. I'm going to explain a lot of the nitty-gritty details of everything just because I know that was super helpful for me when I was trying to figure out what to do next, because it can be so confusing when you have so many voices. But I also wanted to make a little series about this, so follow along with the other videos I will post soon. So in a few days from now, from when I'm filming this, on November 17th of 2025, I will be getting hip surgery, and I might have already had my hip surgery by the time I post this. So I'll be getting a left hip arthroscopy, which is a really fancy word, but it basically just means they're gonna fix my labral tear, and then also they will be fixing my cam impingement. So I'll say that in basic terms because I barely even know what that means, but basically for my labral tear, the cartilage that lines my hip socket and meets the top of my femur has torn. So now every time I move in a certain way, it kind of pinches and grinds like near my inner groin, which is a really fun thing to visualize. But then for my cam impingement, it's basically when your femur isn't shaped the way it's supposed to, and so it kind of prevents the femoral head from being able to rotate and move smoothly in the hip socket. So then over time, that constant wearing and pinching has probably led to why I have a labral tear. And not everybody who has a labral tear also has an impingement, but it is decently common for people who have labral tears. But my impingement could have been just something I was born with, or it could have developed over time, just the way that I am so active and I was basically in like every single sport growing up, so my body just kind of shaped its way to compensate for my active body. So that's kind of what I'm thinking happened, but I really have no clue. Okay, let's get into the nitty-gritty details and talk about the start of my pain. So basically in my junior year of college, it was November of 2023, I was in 2 dance shows, and the dance shows in college are pretty strenuous, exhausting processes, and I started experiencing low back pain, specifically on my right side, and just for reference, my labral tear is on my left side. And then at the point, I couldn't really say that I started feeling pain in my left hip, it was just more a lot of tension, I would say. But all this pain was super gradual. It wasn't just like one instance where I had just complete start of pain, but it was more gradual. So my back pain was definitely more severe, and I remember not even being able to extend my back at that time and rotate, and I really can't extend my back currently, but rotation is fine. But at the time, I really didn't think anything of my pain, and I remember I was having to do a lot of hinging in one of the pieces I was in, and just, of course, a lot of hip flexion, like kicking my legs really high, and so I didn't really think anything of it, and I've never really had an injury, so I was just hoping and praying that it would go away. And I also had a winter break coming up right after those shows, so I was just like, okay, if I just make it through this, I'll be fine and it will go away in my winter break. But you can kind of guess where this is going. It unfortunately did not stop. So then I ended up finishing off my junior year, so spring of 2023, and then went into my senior year of fall of 2023, and this is kind of when my pain just gradually started increasing, and it was also shifting to where it was now my entire low back that was feeling pain, and I had a lot of inner groin pain where it would really hurt if I would cross like my midline at all with my leg, or just like rotating my feet in was super painful, and laying on my stomach I couldn't do because of my back pain, and just sitting in different positions was really painful. So that's when I really started to notice the pain, and I was like, oh, so this really isn't going to go away by itself. And at this point, it wasn't just limiting my ability to dance, it was limiting my ability to just live as a human. The funny thing is, I felt like I was in so much pain then, but the pain that I'm in now doesn't even compare. And I remember at this point, this is kind of when I started having to sit out of my dance classes and modify a lot of stuff because I was just in way too much pain to just keep up with the pace that I usually was at. And if you are a dancer, you know just how horrible that feeling is to have to sit out of class, because you're not only frustrated because you have to sit out of class and stop doing what you love, but you feel like you constantly have to validate and prove that your pain is like actually genuine and you're not just sitting out because you're lazy. But from this point on, I kind of got a push from some of my teachers, and I kind of realized it myself that this pain was not going to go away naturally, and so I needed to seek actual medical help. And it was scary for me because, like I said before, I never have really dealt with an injury before, so I didn't really know where to start. So then during the end of my Christmas break of my senior year, which was about a year and 2 months after I started feeling the pain, I set up an appointment with my primary care doctor on January 15th of 2025. Basically, I just explained all my symptoms, and she ended up giving me an anti-inflammatory, which I would take every day, but ended up not working, which I have heard from other people with labral tears that that's a common thing, that it just like doesn't help at all. But then she also referred me to physical therapy. And then I had my first PT appointment about 2 weeks later, and just a reminder, if you're dealing with a diagnosis journey, it's going to take a while to get into appointments. So getting in after 2 weeks is ideal, but you know, sometimes it takes months to get in. But basically, I just filled out some paperwork explaining my injury, how it happened, my symptoms, my medical history. And then when I was in the room with her, she kind of did an evaluation where she tested my mobility and my range of motion and checked to see if I had any like major imbalances. And then to my surprise, she told me I had a labral tear. And at the time, I genuinely had no idea what a labral tear was. I just heard the word tear and I was like, this is the end of the world. And I actually got pretty emotional in her office. I started tearing up because I was genuinely expecting just like a few exercises and to be on my merry way, but obviously it was a little bit more than that. But looking back, I'm just so grateful that God gave her that understanding, because even though those were sad tears in the moment, I'm grateful that she was able to recognize the tear. And if she hadn't, I probably would have gone through so many more unnecessary steps before I actually got a possible diagnosis. So then my PT kind of told me that doing physical therapy wasn't the exact route that was going to solve my issues, obviously. So I continued doing it for a few more weeks just to get my strength up through the process. But I ended up stopping a month in because I wasn't really seeing any progress, and I'm pretty aware of my body myself, so I kind of knew what I needed for my body. But then I was referred to a doctor at the Orthopedics Association of Wisconsin office, which I live in the Milwaukee area, so it wasn't too far away. And the first thing that I did was I had an x-ray done, and this was on February 18th of 2025, so it was about a month later from my original appointment. And actually, from my x-ray, they were able to notice that my left hip was significantly irritated, but my back did look normal, so a little good news and a little bad news. But because x-rays aren't super detailed, you can't really see like your cartilage or your ligaments, or just basically what they needed to see in my hip. An order was put in for me to get an MRI with a contrast injection, and I got that about a month later. So again, it's gonna take a while for me to get to where I am now. And for me, this process was pretty crazy because they first put me in a hospital gown, which I have not been in a hospital gown in my adult life. But then they wheeled me into a different room and they injected my hip with contrast fluid, which basically it helps the MRI highlight the specific things that they need to see for a labral tear, like my labrum itself, the cartilage, my hip joints, and so on. And when they injected the fluid, it's like truly something that I cannot explain unless you've had it actually done yourself. But what I can say is that it like almost felt like it was a balloon like blowing up and expanding in my hip, because my hip just felt like heavy and it was just like full. I don't know, it's such a weird experience. And then when I got my results back, it did confirm that I had a labral tear, and my tear is within the anterior superior part of my labrum, or basically the front top part of my labrum, if that makes sense. And they also noticed that I had some mild swelling actually in my femur bone, which I don't even know that was a thing, and that doesn't ever come up again. And as I was kind of like writing down this whole process, I kind of forgot that they told me about that, and so now I'm thinking like, should I be concerned about the swelling in my literal bone? Like, what? But then at that time they did notice that I also had a hip impingement. But from there, since they knew that I did have a labral tear and a hip impingement, they wanted to be able to confirm that my labrum was actually causing my pain and not just something else irritated in my hip or related to my back possibly. So then what they do to see if it is your labrum is that they give you a diagnostic injection, and basically it's where they put a numbing shot into your labrum. And what my doctor told me is that if the numbing shot worked to where I barely had any more pain, they would know it was my labrum, but if it didn't work, then it was something else causing my pain. And that process of actually getting the injection wasn't too bad. It was a little bit more painful than getting like a regular shot, but again, wasn't bad. So I was really hopeful that I wasn't gonna feel any more pain with the shot and that it was actually gonna work. And you know, I thought it was gonna work, but it didn't. And yeah, at this point it brought a lot of confusion and frustration, because I was like, I was so confident that it was my labrum, and everything that I've been reading online validated all my pain, saying that it was my labrum, but then the injection basically told me that it wasn't. But as I know now, it was in fact my labrum, and they actually did the diagnostic injection wrong. If you are going through this experience, don't be afraid to get the diagnostic shot again, because if I would have done that and gotten the shot again, it would have saved me from months of waiting. And basically from there, my doctor told me that she couldn't help me anymore. So I stopped seeing that doctor and she referred me to a back doctor instead. So then in late April of 2025, I started seeing my back doctor at the same office that I saw my hip doctor. Basically the same process. I explained my timeline, my symptoms, and everything that goes with it. And let me tell you, if you are looking for a diagnosis, you will have to say this so many times, not only in person, but also online, typing it out in forms. So be prepared, have your story down exactly to the very detail. But anyway, from that evaluation, my back doctor told me that I possibly had a herniated disc or spinal stenosis. And just for context, a herniated disc is when one of the discs in your spine tears due to like an injury or just wear and tear, and this can put pressure on the spinal cord. And then spinal stenosis is when the space inside the backbone is too narrow, so then it can cause pinching of a nerve or again the spinal cord. So then I had another MRI, and guess what they told me? It wasn't my back. And guess who knew that already without having to see the MRI? I did. But basically the only thing that they found is that I have minor scoliosis, which that's a fun fact that I know now. And so since my MRI results basically showed nothing, my doctor told me verbatim that I could either get stronger and continue doing PT for however long it takes to take away my pain, or I could take medicine for the rest of my life, or I could just live with it. And genuinely, I know I'm being like really silly in this video, but that genuinely crushed my entire spirit, because I was like, how could there be no other options besides those three? Deep down, I knew that it was something that they were overlooking and they just didn't find yet, but then at the same time they told me that they really couldn't help me anymore. And then at that point, I honestly really felt like gaslit, that like my pain wasn't severe enough or significant enough for them to actually help me. So at this time, I actually did end up taking a break from my diagnostic journey just because I was so frustrated and I didn't really know where to go from there. And at this point, when I was seeing my back doctor, I was again a part of 2 different dance shows, and this took such a toll on my body. And I remember during show week, I was literally walking around hunched over because my back pain was so terrible that it felt better for me to be literally curved over like an old person instead of standing up straight. But because of that, I decided to go a different route, and I went to go see a chiropractor that one of my professors had suggested to me. But seeing the chiropractor didn't really have much benefit because I would feel relief the day of, but then the next day I was back to square one in the same exact pain, and so I ended up going twice, and then I stopped after that because it was genuinely just not worth my time and money. And I had to take the Milwaukee bus down there, and I got lost so many times. I was like, this is just, it's not worth it. And after I started seeing my back doctor and the chiropractor, I kind of just left it there for a while. I graduated, I started my summer jobs, and this was like the first time that I wasn't dancing since I was like 3. So after a few months, I went back to my primary care doctor, which is where I started this entire process, if you remember, and I went there on August 4th. So it was about a year and 9 months since I started first experiencing the pain, and about 8 months since I started getting help. But my main goal in going back to my primary care doctor is just kind of give her an update, and then also I was really searching for a different referral for a doctor who could better help me. And I actually ended up going with a doctor that my mom found online, and this is the doctor that I am with now and who will be giving me my lovely surgery. But my new doctor, Dr. Duros, he works at Freighter in Milwaukee, and what was super exciting about him, and is one of the reasons why I went with him, is because he actually works for the Milwaukee Bucks and the Brewers and the Milwaukee Ballet. Like, mind actually blown. I was like, this is perfect. And his experience with athletes has just like entirely made the world of a difference. Some of the doctors that I had been seeing previously would say things like, well, just don't kick as high, or does it hurt when you're doing the splits? And like, they genuinely said that. And that's honestly been one of the biggest learning lessons that I've had throughout this whole process. Seeing a doctor is like an interview. You don't have to go with the first person that you see. You're allowed to go with someone who actually listens to you and takes you seriously. So the right doctor makes a huge difference, believe me. And sometimes I get into the thinking where I'm like, oh, if only I would have just done better research, I would have saved myself so many months of appointments and pain. But I keep repeating the verse, Proverbs 16:9, which says, in their hearts humans plan their course, but the Lord establishes their steps. So then when I started seeing Dr. Duros, my current doctor, I was basically back to square one because my doctor wanted to go back through everything that I had already been through to make sure that nothing was being ignored. So we started back with the diagnostic injection. But if you remember, the first injection that I had failed. So I was really curious to see if it didn't work because the person did it wrong, or if it didn't work because it wasn't my labrum. And guess what, everyone? It worked! Amazing! But this was a really strange experience because they told me that the numbing would work for a range of 3 to 6 hours, but mine only worked for an hour, and half of that hour was me literally just sitting and driving home. But anyway, I was still so happy to be one step closer to actually figuring out what was wrong with me. Then after they had that confirmation that it was in fact my labrum, my doctor went ahead and ordered me a CT scan, which I had only had 2 MRIs, so this was a new experience for me. But then when I finally got my results back, my doctor actually told me that my hip looked like a 40-year-old's hip instead of a 20-year-old's hip. So, that's crazy. But he also told me that my hip has increased joint thinning, which basically means that my cartilage is like really thin. And then he told me that my joint spacing is also narrow because my cartilage is so thin that like my bones sit like closer together, which is probably to explain for a lot of the like pain and grinding and clicking that I feel in my inner hips, because like my bones are like nearly rubbing together. And then they also confirmed my cam impingement, and then to my doctor's surprise and concern, he found that I had bone spurring, which basically means that my body started growing little bits of extra bone around my hip joint, and this was actually my body's way of protecting the joint from all the friction. And so this is actually the first signs of arthritis, and this is very uncommon for somebody my age to have early signs of arthritis. Oh, and also they confirmed my labral tear. But the bone spurring was concerning enough that my next step was actually not to have surgery, but to get tested for an autoimmune disease. Because if I had an autoimmune disease, it would explain why my hip is deteriorating so fast and why I do have that bone spurring. And it could be an explanation to why I have so much low back pain. So I went in and I had to give 5 vials of blood, which I've never given blood like that, and I've always thought that I would faint, but luckily I didn't. But I got my results back pretty fast, and luckily I do not have an autoimmune disease, but that leaves it up to question like why my hip is deteriorating so fast. So that's still a weird question that we don't have answered. But from knowing all this, after 2 whole years, 4 doctors, and about 30 appointments, my prayers were finally answered and I was approved for surgery. And I was actually only given 2 weeks between the time that I actually scheduled the surgery, like the day that I put my surgery date on the calendar, between when I'm actually getting my surgery. And I've only actually been seeing my current doctor for about 3 months. So technically I haven't had too much time to prepare, but I feel like I have been mentally preparing for surgery for like a year now throughout this entire process. But between these 2 weeks that I've had to prepare, I've been making a lot of phone calls to get all like my medical equipment. I've been setting up appointments for pre-op and post-op. I've been scheduling PT, and then also just like generally getting my house ready and my brain mentally ready for everything that's about to go down in a few days. But after my surgery on November 17th, I will be in a brace and crutches for about 2 weeks, and then after that I'll just have the brace for 4 more weeks, so 6 weeks in total. And then I'll also have a lot of appointments in between with my doctor, and then a lot of PT appointments. So then the entire recovery time will be about a year to a year and a half from when I will finally start feeling like myself again. I've been trying to figure out what I'm gonna do in like the 6 weeks that I'm gonna be basically out of commission, and I've saved a lot of shows and movies. I've actually prepared some crafts to work on, but I'm gonna try and make the most of this time I have to rest and recuperate. But thank you for watching, and stay tuned for the other videos I'll post about my surgery. Here you can click on some of my past videos that YouTube thinks that you'll like, but like and subscribe, and I'll see you guys later. Bye!